What's up, A to Z Sports here live with a little doc talk segment thanks to the Bone and Joint Institute. We got Dave Kempfert here, their director of PT, former NFL offensive lineman. Just kind of talked about that while we were waiting to get started here. But Taylor Lewan's surgery was done on his ACL on Tuesday. So now his physical therapy and rehab process will begin. So we thought it'd be great to talk to an expert who has played offensive lineman and somebody who works with a lot of ACL rehab. So we'll talk to Dave Kempfert here from the Bone and Joint Institute. The Bone and Joint Institute, the region's destination for comprehensive orthopedic and sports medicine care. They've got everything. They got the doctors who can fix it, and they've got the guys like Dave who can get you back to doing what you're supposed to be doing. So Dave, welcome in. Thanks for taking some time.
Yeah, thank you guys. Appreciate it.
So Lewan told us via his own platform on Bussin' with the Boys that it was a pretty clean ACL tear, right knee, no meniscus damage, very insignificant bone bruise, but not a lot of other ligament damage outside of just the ACL that happened a couple games ago. How rare is that to happen? Because I know I tore my ACL and I had a couple other things come with it too.
Yeah, the bone bruise is pretty common. Most of the time, if they're a minor bone bruise, that's the thing. Basically, for anybody listening, there's the cartilage can basically clack together and compress, and you basically get some bleeding on the outer cartilage of the bone. It can be very, very painful. If it's bad enough, sometimes it can affect the articular cartilage a little bit. So it's good to hear that he didn't have a whole lot of other involvement, and I think that was pretty minor. But as far as in general, when you get an ACL, there usually is some other kind of tissue that's compromised at least. And so a lot of times the most common thing you'll see with an ACL tear would be a medial meniscus tear. Occasionally you can get tears of the lateral meniscus. And again, that's the cartilage, kind of the horseshoe-shaped cartilage that's in between the bones. And you'll see that kind of come along with it too. And depending on the where the tear is and how severe the tear is, that can affect initially how the rehab goes. But for the most part, the ACL is the dominating factor of the rehab component.
Yeah, I'm curious, and we see in football, and you played football yourself, I feel like ACL tears have become so more prevalent, but people and players get back from them a lot quicker, maybe due to technology, maybe due to things that you do, and the rehab has changed. What have you seen over the last several years of just the ACL tear and how it has evolved on how players get back to action?
Yeah, it's definitely changed a lot. And there's always going to be, we're always trying to improve not only how we do the surgeries, but also how we do the rehabilitation part of it. The big thing for me is that some things don't change. And because there's so many people who tear their ACLs, it's almost become like, oh, it's an ACL tear and people just get back from it. And people forget that's a devastating injury. And it does make a big difference as far as the other components that go on with it. But I think a lot of times it's become almost so it affects how we treat patients that aren't your high-level athletes too. But you get Adrian Petersons that come back in 6 months, and people think, "Oh, that's a 6-month injury." Well, yeah, I think the biggest realization that we've had is it's not the best to go by time. It's more on biomechanical function. And so I think we see the pro athletes come back a little faster than the high school kids or the college kids or just the recreational athletes, because they are such finely tuned athletes. They are stronger, more flexible. They've had a lot more time to do things. So to improve their biomechanics and their balance, and they work on those things a lot. And so I think that's why you see some people come back a lot faster when you're at that level. We still know that there are timelines for healing, and that we know that the blood supply to the ACL and the ability to gain the neuromuscular connection, so basically the relearning your balance and how to get back to your functional activity, that still takes time. And there's a lot of studies out there that'll say, gosh, you still want to, the vascularity of the blood supply to it, you still want to wait 6 months usually for one of those to come back. 6 to 9 months is generally the range that you'll still hear. It's going to vary between doctors. It's going to vary between the type of athlete you are. But when you look at the general timelines of 6 to 9 months, that's what most people will look at. They've actually done some studies, and this isn't necessarily in high-level athletes, so take this for what it's worth. But in general, if someone waits every month, they wait. Sorry, guys. Every month they wait to come back up to 6 months or up to 9 months, excuse me, decreases their chance of re-tearing by about 51%. Now, in the general population. So it's one of those things that, yeah, if a guy tears it early in the season, if you can give him more time and not force a spring on a guy or something like that, the studies are showing that you are a little better to wait. And that doesn't mean you're inactive by any means. There's a lot you can be doing at that stage, but to get back to full speed, full contact, there's a lot of components that you want to see there before you really rush anybody back.
So we were joking around when we were at the Bone and Joint last week about like the post Lewan made on social media, basically calling the ACL a weak ligament. That all we ever hear is the ACL is torn. And so,
Right.
why do you think the ACL is tearing more than like the MCL or the PCL, LCL? Why is it the most prevalent ligament damage from a knee in sports?
Yeah, and the funny thing is you'll hear that a lot. Like, gosh, that thing must be weak because we hear about it all the time. It's actually, I mean, there's some studies that show that it can hold up to 500 pounds of force. That's a lot of force. Now, when you got guys moving at the speeds they move in athletics, especially professional athletics, and also guys that have a larger body mass and weight and force production, then of course then you're putting potentially more. The ACL is an amazing ligament. It's actually two bundles. It's not just one, static structure in there. There's two bundles, and they work differently to stabilize how the lower leg moves on the femur, front and back, and also has a rotational stabilization component to it. But you got this ACL, which is still a small space and a very important ligament between two long bones. So just like if you have a longer lever arm, if you got a bolt that's stuck and you use a small wrench and it's stuck, you go get the one that's longer, right? So you can crank on it and generate more force. So you got an ACL between two long bones, especially your femur being long and then your tibia. And so that can put more stress on a joint, but also just the nature of athletics because of what it does in stabilizing your lower leg. When you're in a sport that's a lot of aggressive cutting, unpredictable, movement needed, as well as contact, it's unfortunately a recipe for an increased number of ACL tears.
We're talking with physical therapist Dave Kempfert on Doc Talk, brought to you by the Bone and Joint Institute right there in Franklin. We've got a great relationship with the Bone and Joint Institute. You can too if you have any minor injury or feeling bad. Austin and I both have gone to the Bone and Joint Institute, and we've used the doctors that have worked there. Dave, I'm curious about Lewan's rehab because you mentioned, the weight. And this is something that Lewan actually mentioned, that he was going to try to lose weight through the process of rehab. Mm-hmm. What's the hardest part about rehabbing an ACL? And let's just go a step further and you may know this, just for an offensive lineman and what all that they have to do.
Mm-hmm. Yeah, it's a great question. There's so many components of rehab. So number one, I mean, one thing that's great about professional athletes a lot of time is mentally they're there. They're a little, and it can be devastating injury, but a lot of times they've been through this process before, even if it wasn't as bad of an injury. So the psychological component's huge. So for guys to be able to start up and get after it and have the resources of people to encourage them and take them through the process and educate them on the front end of what's going on and having been around athletics, that's a big part of this. So that becomes like, hey, this is my process. I'm going to go into it because that's a major step for a lot of guys to get over. The other part of it is how many structures are injured. So if the cartilage is damaged in between and you're a heavier guy, then yeah, the cartilage will take a little bit more force. If there's a lot of damage to the cartilage or the meniscus cartilage, or not just the cartilage that necessarily is at the end of the bones, then you have to take those factors into play how fast you can rehab, because you might want to decrease your loading on someone who's had a little bit more of a cartilage injury than someone who had just a straight ACL. The process initially starts with just getting your quad firing, making sure you get terminal knee extension so your knee is getting nice and straight. Usually you can start weight bearing if there's not a lot of cartilage repair or anything like that done. You can start weight bearing early on, and you want to do that if you can. You limit things and you gradually progress, but keeping the swelling down, range of motion, getting back is the most important. But after that, it's a gradual progression of getting back to function. A lot of times the biomechanics, like we said, starts real early, and it may start in ways that seem boring to athletes and they get a little frustrated at first, but taking it as a step process. And as soon as you pass, certain goals, then we're able to progress. It is tough sometimes. And I usually tell my athletes, whether it's pro athletes or high school kids, and I'll say, listen, there's going to be times when you're upset at me. You're going to be mad at me because you're going to feel so good. You're going to feel like, man, I can do those things. And I'm still going to say no to certain activities for a while, just because of the healing timeline. So a lot of people don't know this because they think there's like this, stepwise progression of healing and getting better. But your ACL is actually weaker at 6 to 8 weeks than it is early on. So just when people are really starting to feel good, there's some caution that you still need to take with that. And then after that, the increased blood supply starts to occur, and the actual bundle fibers and the histology, the makeup of the tissue starts to improve over time, and significantly at 9 to 12 months. And those things get better. And then when you get out to 6 months, usually that's when, you really just look at it and say, we can get back to almost everything we want to do at 6 months, or sometimes a little earlier. It's a case by case basis. But I think you'd asked earlier, and I kind of didn't follow up like I should have. But one of the big things that we've seen is it used to be like a time-based progression. So if you're 6 months out, you do this. If you're 3 months out, 12 weeks out, whatever it is. And what we've really found out is there's certain things that need to go by time, but the other things, it's way more important to go slow and get the biomechanics and the function back first, get that balance, get that stability, and working on core and all these things that are outside of your knee specifically have all the difference in the world with making sure that you're going to get back and get to that highest level of sport again. And I'll tell people too, say, hey, it's a big surgery, it's a big injury. There's a lot of things that come into you getting back to sport, but there's no reason that people can't go back and be a better athlete. I remember this is years ago. I'm a little bit of an old guy now, but when I was in college, freshman year of college, my best friend tore his ACL. And back then it was, you're not back to sport for at least a year and you're probably never going to be as good an athlete as you were. And this guy came back and had a great PT, had a great plan, worked his can off, did everything right, and was back at 7-8 months, and 40 time was better, vertical jump was better, agility drills were better. And that's what suckered me into PT. I was like, man, not only did they get this guy back, but they made him a better athlete. He went on to have an NFL career too. So there's so much exciting things going on in rehabilitation. And especially, it's all, I'm not gonna lie, like I love working with regular people. When we get the athletes in here, the pro and college, high school athletes, it's a blast because there is that mindset of there's not just a goal to get back to life, but there's a goal to get back at being the best at what I do. And that's what makes it exciting. And I think that's what's going to drive guys like Taylor Lewan to get back and show people that not only my back, but y'all better watch out.
Yeah, well, and Brett, because I was going to ask this, because Brett on Facebook says, will Taylor ever be the same? And like you just said, there's a chance he could be even better. So why does that work that way? Why could someone be actually stronger after this surgery and the rehab process compared to what their normal natural ACL would be normally?
Mm-hmm. And it's not necessarily that the ACL would be stronger. So let me put there.
Okay.
But it's the fact that they've worked on a lot of biomechanical things that maybe they never did before. So rehab sometimes takes you through processes that are outside of your standard squats, power cleans, presses, lunges, all those type of things. And you really start working way more core than you've worked before. Maybe you work a little more biomechanics, dynamic balance, lots of different challenges, things that maybe weren't part of your program before. And that's why it's so important to incorporate these things as a PT. Now I'm going to throw my little bit in there, but on the front end, to get athletes doing some more of those things on their own. And hopefully the goal is to prevent these things from happening, obviously. But the prevention stuff is a lot of times the same thing you do with the rehab.
Right.
Get back and trying to protect them as much as you can by doing things that maybe they hadn't done or hadn't focused on as much, as well as what they need specifically to do for their sport.
This is kind of an off-the-wall question, and we're talking with Dave Kempfert, physical therapist at the Bone and Joint Institute right there in Franklin. This is our Doc Talk segment, and we're talking about Taylor Lewan's ACL rehab. But you've done and rehabbed a lot of people with injuries and with ACLs, as you've explained. What percentage on a scale of 0 to 100 is mental about getting back instead of just the physical work?
I think that's a big part of it. I wish I could say a percentage. I'm not going to be able to give you a percentage on that. But I tell you what, there's something called kinesiophobia, and it's usually a word that most people are like, what? I don't know what that means. But it's basically fear of movement. And it's hard. The mental part of getting back is very, very difficult at times. And some people, it's easier than others. Unfortunately, I'll see kids that tear their ACL and they'll go back to sport and potentially tear their other one a year or two later. And that happens. And they'll come in, and I'll tell you what, it's a totally different athlete usually coming in the second time around than the first. Because they know they got back, they know they did well, they know that their other ACL held up, and unfortunately they tore their other one. But now they're coming back in and they've known the process. It's not their first rodeo, and I've just seen them mentally attack it as well as the physical part, which they did well before too. But that's a big part of it, and it's important to have people around you. I think if people are struggling, there's no reason not to use sports psychologists and those type of things. But having support around you. On your team, knowing that you're going to get back, obviously, is sometimes a crucial part of it, just like any multidisciplinary rehab would be, with just communication with the doctors and the trainers and the physical therapists. But having somebody, that mentally is tough getting back to, it can be crucial.
How important is trying to get the athlete back to where they're not overcompensating? And so Lewan hurt his right knee. How does he work on that where he's not putting actual more weight and more stress on his left knee while he's still working on his confidence in his right knee to get back? Because I know that's something that I struggle with. Now, when I tore my ACL, I was a college kid trying to get back to playing intramurals and drinking beer. So I wasn't like focused on that like he is and like pro athletes are. But how do you approach that?
Yeah, it's tough at first. And honestly, a lot of times you don't progress until you get them to break down those small little components. Because the last thing I want to do is have somebody with an asymmetry in their legs and then say, okay, well, you're not hurting, you're not swollen. We're going to go to that next phase of something more difficult. And then now all of a sudden you're creating a movement pattern that's not advantageous to him getting better. So a lot of times they'll say, hey, guess what? I'll even throw it out there and dangle a little bone out there, and I'll say, hey, you can go to the next phase as soon as you show me this, this, and this. Mm-hmm. It's very, very tough sometimes to overcome that, because, it's not only are you fearful sometimes, but even if you're not fearful, the swelling in the knee or the tightness that you may feel will just automatically make you adjust to your stance and things. So, and the reason that's a great question too, Austin, is when it comes to rehab, it's so important to focus on the other side. A lot of times what we'll see is kids will come back and we'll even do some tests sometimes where we'll test an athlete's ability to hop on one leg for distance, or do triple hops or speed hops, those type of things, and how far they can get into a single leg squat and still maintain balance without their knee diving in. All these different tests we put them through, and you kind of compare it to the other leg. Well, you're comparing it to the other leg is only as good as you made the other leg maintain what it was before, or hopefully stronger. So the last thing I want to do is say, oh, you're 100% of your other leg, but we let your other leg go to garbage during your rehab on your ACL side, right? And so for us, it's very, very important that we're training both sides at the same time. So as soon as it's appropriate to do that, and they're able to do that, that's always a point of emphasis with us, is doing rehab on both sides. Not only because I want to maintain them as a whole athlete, but to make sure that they're not setting themselves up for injury on one side versus the other, or a potential tear on the other side, because we focus so much on the ACL knee that we forgot about the other one.
How much of your work do you work when you work with high level athletes? Do you work on position specific rehab, or is that something that's so later on down the road in their process?
No, we definitely try to start that early. I mean, there's steps that you go through, obviously, that you want to see, and it's mostly getting back to your functional activities of daily living, at first. But as soon as we can, I mean, I'll have kids, like, when they can stand, I'll say, go ahead and shoot your free throws, and if you can get into a football stance, then get in your stance. Get used to being comfortable in your stance again. When it's safe to start taking, for an offensive lineman, which of course I love when they come in, because that just brings back all the memories. But getting them in their stance, saying, guess what? You're fine to start taking your pass sets now. So work on your pass sets. Work on staying low. Work on holding in that position, getting comfortable, and not only does that help them physically to get back, but mentally, when it comes back to, hey, you can go back to sport. They've already been doing it for 3-4 months sometimes. In some aspects, obviously it progresses and gets harder and harder, and we get more aggressive and more sport specific. But if I've got a kid that's been getting in a stance for 4 months, then every step you take along the way is a little bit more palatable to him, and he feels more confident with it.
Great stuff from Dave Kempfert, the director of PT at the Bone and Joint Institute, boneandjointtn.org. Hey, if I get hurt again, I at least know that I have somebody who's played at a high level.
You know a guy.
I know a guy.
There you go.
I know.
Stay healthy, man. Don't come in to see me if you can help it.
Well, yeah, I know, right? I want to stay away from Dr. Arthur. I like Dr. Arthur, but I don't necessarily need to see him other than popping in there for some shows. But thanks for the time. Appreciate it a lot. Great information. And we'll talk to you again soon.
All right. Thank you, guys. Appreciate it.
Thanks, Dave.